Hi, I'm Sarah Cornwell and I'm the lead therapist here at the Employee Assistance Program here at Phoebe Putney Memorial Hospital. Today we are here to answer some of the questions that you guys submitted through our Ask EAP email in regards to suicide, suicide prevention, and grief. I encourage to stay away from questions just like, how are you? Because in general, most of us answer those questions just good or fine. So I think sometimes asking more direct questions or even open-ended questions are better when we're trying to talk with friends, family, or others in regards to our thoughts and feelings. So an example of that might look like, recently I've seen that, you seem a little down and out. Is there something that you would like to talk about? Or sometimes it's just simply letting our friends, family, and support systems know that we're there willing to listen if and when they'd like to talk. A simple answer to that would be no. Suicide related to both PTSD as well as depressive disorders looks very similarly. However, there are some warning signs we should discuss. If an individual starts to talk about death or even talk about hurting themselves, we should always take that seriously. If we see someone becomes increasingly isolated, if they start to have impulsive or reckless behavior, if they have increased depression and anxiety, or even increased or decreased sleep, they may also, if they have any substance abuse usage, that's something to consider. Also, if they have access to armed weapons, that's also something we should consider. Warning signs are similar for both teens and adults. However, what we have to remember is for teens, their main support group is their peers. And there are some things that we should take into consideration. Oftentimes it's those social circumstances. So if there's been a change in a teen or adolescent's peer group, we should take that into consideration. If there's recently been a divorce or a loss or a grief, also if there's any issues related to bullying or low self-esteem, these are all things we should take into consideration, in particular for teens and adolescents. If there is a child or a teen or adolescent that is saying that they've considered suicide, I think it's essential for them to be assessed by a licensed professional. That may be their primary care physician, their pediatrician, again, that might be a psychiatrist or even a therapist. If and when they are assessed, then that licensed professional can assess what needs that child, adolescent, or teenager may need or require. That may include ongoing therapy, that may be medication management, it may even be possibly inpatient hospitalization. But again, that licensed professional can help make that assessment for you. Luckily here at Phoebe Putney Memorial Hospital, we have our very own behavioral health unit located not only in the main hospital, but we also have our own behavioral health EC, where individuals and children and adolescents and teenagers can be assessed. There, they will be assessed by a psychiatrist to figure out whether or not inpatient hospitalization is necessary or if maybe just outpatient care and medication management is needed. Children and adolescents and teenagers are actually not able to be hospitalized inpatient here at Phoebe Putney Memorial Hospital. And if they need inpatient hospitalization, they will be transferred out to likely a local hospital, probably somewhere in Southwest Georgia or possibly even in Atlanta. I think it's important when we're talking with individuals in regards to their thoughts and feelings, again, is to simply listen. Oftentimes, individuals just really want validation for their thoughts and feelings. What we also have to remember is that in listening and in validating someone's thoughts and feelings, that doesn't mean that we have to always like or understand what we're hearing, but it is being respectful of truly listening to what that individual is trying to communicate to us.